Go ahead, Rob.
Deborah, would you have a few minutes after the meeting?
Yeah, sure.
Okay.
Let's call to order. Good morning, folks. This is the March 14th meeting of the Budget, Capital, and Personnel Committee. It's a bright, sunny March day. 2 days in a row. This is amazing. We're going to have some changes to the agenda, but let's do the minutes first. Someone want to move those? February 8th. Shauna, seconded by Deborah. Discussion about the minutes. Ready to vote? Those in favor? Any opposed? That's unanimous. On the agenda this morning, some changes. We've got two resolutions on your desk to add. One to authorize acceptance of funds from the opioid settlement, that's out of Whole Health, and one supporting the modernization of the state sales tax laws. That's easy for me to say. And that's, I believe, has already been through HED. So we'll put those at the end of our resolutions here. We're also going to withdraw Resolution D, which is not ready for prime time yet. That was the resolution having to do with funding for the Soil and Water Conservation District, and that will be coming back with revisions.
Just a point of order. Do we need a resolution to add these?
I don't
We
think
just
so.
do that. Okay.
Not in committee. We usually do it at legislature, but if you want a resolution, we can certainly do it.
No, that's fine.
Any other changes to the agenda? Oh, we won't need to have an executive session either. Let's go. Do we have any comments from the public? I don't see anybody in chambers. Anybody online? We have no comments from the public. I would like to move Resolution A up. That's the appointment to the Tompkins Cortland Community College Board of Trustees. And I want to do that because we are joined both by President Amy Kremenek from the college and also our candidate for reappointment, Roxanne Buck. Good morning to both of you, and thanks for being here this morning. I wonder if someone would want to move this resolution for appointment. Deborah, seconded by Lee. This is an appointment to the College Board of Trustees. We have 3 from the Tompkins County Legislature, and Roxanne's is up this year. She's been serving. I believe, Roxanne, you're the longest serving member of the Board of Trustees. And she's, in my opinion, does a great job. But I'd be glad to hear from Amy if you have comments. And Roxanne, you've given us your resume and that's been passed around. Everyone's seen that, and then let's ask for comments, and then we'll open the floor up.
being considered for reappointment to the board, and I'd like to thank you for your willingness to consider this.
Thank you for those comments. Roxanne, would you like to say anything to us?
I think I'm in a better position here with the.
We can hear you now. Yep.
Thank you, Amy, and certainly thank you to Mike as well. It's certainly been my pleasure and honor to be on the TC3 board for these number of years. And, you know, I really appreciate the support from the county legislature to be your representative there. TC3 has gone through a number of changes, and, you know, it's been my pleasure to be part of those. And certainly under Amy's leadership, I think we're on a wonderful trajectory to continue those wonderful, magnificent changes and things that TC3 is known for. We've got a lot of wonderful things going on, many of which are financially supported by the Tompkins County Legislature. So again, we thank you for all your support over the years. And, you know, I hope that I've represented you well, and would love the opportunity to continue to do so.
Thank you for those comments. I'll open up to the floor. Deborah.
I just have a question. I noticed that Roxanne's now living in Cortland County.
Yes.
Is it?
I can respond on that.
Thank you.
That came up last time that she was appointed several years ago. She had moved from Tompkins over to Cortland. And based on the authorizing law, it was researched, and she could still be our representative. And of course, she works here in Tompkins County, and I think her heart's here. She was born here, or grew up here, I should say. So I don't know whether you want to respond to anything on that, Roxanne, but we did look into it.
Okay, thank you. Well, I did notice that she was born, raised, and lived here for 55 years, so I guess that's good enough.
Rich.
Yeah, I'm fine with having our candidate actually.
We can attest to that.
I can attest to that local connection. Roxanne is a Groton native, and I've known her for, well, she and I probably would longer than we would want to admit, and worked professionally with Roxanne when she was employed with the State Assembly, Assemblyman McNeil's office, and many years now at Cayuga Medical Center and in other capacities, and I can attest to the fine person and qualifications, and very pleased that she's willing to continue serving on the board and representing Tompkins County.
Anyone else?
Thank you.
Okay. Would we like to vote? All those in favor? That's unanimous. Thank you. We'll be moving this up to the legislature for final consideration.
Thank you so much.
Thank you both for coming.
You. And thanks again, Mike, for moving this up on the agenda. The rest of you should know that I have a 10 o'clock Zoom meeting for the State Association of Trustees to talk about some legislative issues there. So I appreciate you moving it up on the agenda.
Glad to help.
Thank you.
Okay. Thank you.
Well, let's go to Lisa Holmes, our county administrator.
Thank you, Mike. Just a few brief updates this month. Coming back from the NISAC conference a couple of weeks ago, just I think to note that there weren't many budgetary impacts coming from the state that were noted at that conference and through Dave Lucas in his annual update about state funding. The only thing that he did note is the stagnation that we're seeing locally across the state in sales tax revenues. But in terms of the state budget, we're not anticipating any big surprises this year. So We, over the next month and a half, will be putting together and forecasting our county budget in preparation for the legislature's budget retreat. And also, notably, we are in our second search for budget director, and we are interviewing candidates this week. So ever hopeful that we will have a successful search and be able to start a candidate with this 2025 budget process. And then Norma had an update I believe she wanted to mention as well.
I know I've had some legislators ask about getting current information from the budget, and I wanted to just, make it known that the online budget book is constantly updating with a new, it's feeding directly from our financial system. So as things are changing, it's constantly being updated. But we are in the process of developing a report for legislators to be able to go directly into OpenGov and be able to see that information by department as you have questions about budget. I have it kind of ready for testing at this point. We'll test it with a couple of folks and then hopefully be able to roll that out and teach folks how to log into OpenGov when that gets ready to go. And then just one other thing, we're building a ARPA dashboard through the budget software as well, so that you'll be able to see where we are and how much has been spent from ARPA funds, as well as what's still available. And that will include the Community Recovery Fund. Our consultants are helping to gather that information together. So I just wanted to share that with this committee.
Thank you for that. Questions for administration? Well, we're moving right along. Oh, here, of course, you have to have a question. Jeez.
Chatty today.
Rich.
Roadblock, that's right. I know NISEC sent out a report with their summary of the one House bills that the Senate and Assembly passed. I think that came out this morning. And I note that one of the chief lobbying areas for NISAC was EMS service, which would impact our county. And there doesn't seem to be anything in there for it. So they somehow didn't make a dent at all, which I think will have local impacts in '25, certainly, because that's when we're going to be looking for all the resources we can to make sure that system's working. So I was disappointed by that.
That omission will impact.
If you have bad news like that, I'm not going to have call on you from now on. Deborah.
So is it just me? Does anybody else notice a coincidence between the fact that there's no negative impact on counties and the fact that it's an election year? Okay.
Don't forget the Medicaid hit was passed last year. So we get it. We're still going to get that Medicaid hit this year, and I can't remember how much it is, but it's what, 40% or something?
It's the full impact.
Yeah, oh, full impact, okay. So they didn't have to do it this year. By doing it last year, they didn't have to do it to us in the election year.
I imagine they expect our memories to be very short.
Let's go to Lori Scarrett, our Director of Finance.
Thank you. Good morning. A couple quick updates. The in-rem foreclosure process, we currently have 28 properties. 12 are residential, 16 are vacant or commercial. I also wanted to give you a quick update. Our auditors in Cerro has completed the audit of the Tobacco Asset Securitization Corporation. It was a clean audit, and we will be presenting that to the task board on March 20th, and then be entering the information into Paris by the due date of March 31st.
Rich.
Last time you reported, were you at 37 properties? That number sticks in my head. It looks like you've substantially reduced that number.
Yeah, they went down significantly in the last few weeks. Mm-hmm.
Thank you.
Mm-hmm.
We always like that. We don't like to have to foreclose on properties.
Yeah, I'd like it to go down some more. The next thing I have is the casino revenue report for the year-end 12/31/23. And I tried to make the font bigger. And I changed the font to white, but currently that doesn't work. So I'll keep working on that. So I apologize for that. I'll maybe have to put the font back to black. But anyways, you can see the graph, and the 2003 is the one furthest on the left. And you can see that all 4 quarters have exceeded all the other years. So I think that's the takeaway of that graph. The next slide shows the actual detail of the numbers. 4th quarter coming in just under 600,000, year-to-date 2.4 million, which again is our highest that we've gotten since we've been receiving the casino revenue. This next slide just compares the year-to-dates over 23 and 22. And this one, the top line is Del Lago, the bottom line is Tioga Downs. You can see they're kind of flattening out, but holding their own onto where they've been for a while.
Is there damage at Tioga Downs? Wasn't there some?
Fire?
Fire? Horse barn burn, but that doesn't seem to have influenced, maybe a little bit, but.
I'm not sure when that was. This is through December. Oh, it was summer, okay.
That was at the racetrack, though. It wasn't. Yeah, that was, I don't think that would affect the casino other than if it took out some horses.
Don't they have betting on the racetrack?
Yeah.
Yeah. I guess they could still run, they just need barns. Okay.
No more white font.
Lori, I have to tell you, you got scooped this morning by WHCU. They had the report about the casino revenues on when I was driving down. Out of our agenda, obviously.
That's all I have, unless you have questions.
Remind me, we don't budget casino revenue, do we? Any amount? We do. We kept it, okay, did we keep it low to see what the first few years would do?
I think it's as I recall, it was 2.1 million that we budgeted.
2.1? I remember some caution on when and how we included that.
Lee, you're correct. For several years, we did not include it in the budget because we were uncertain. But I think 2 years ago, we determined that we had enough confidence that there would be a revenue stream there, but we've budgeted fairly conservatively. Although 2.1 on a, if it's $5.99 a quarter, it's a little bit more in the middle quarters, I think. We should hit that, but it's not going to be a wide deviation, I think, my guess.
I share your caution, Lee, and I've always worried that things, of course, we saw what happened in pandemic, but that wasn't necessarily the fault of the casinos. But if we start relying on this money and they build another casino in Rochester, and they open the casinos in New York City, who knows what it's going to do? We're getting most of our, the larger part of the revenue out of Del Lago than we are out of Tioga Downs. And we could see that go down. So I think your caution is absolutely right.
There were some articles in the New York papers over the last few days, and there's, 3 entities competing for a city license, and they're talking some massive plans down there, which, if something opens in the city, it's going to hold a lot of the people that probably come up to Tioga Downs down that way. So there's more licenses out there, and the market hasn't been completely filled yet from what I'm reading.
I'm more concerned about Rochester.
Oh,
I think that's going to hit us harder than New York City.
I think you're probably correct. There was the negotiations. They were going to give it to the, as part of the Seneca negotiations, give them that, and then the Rochester or some of the other legislators from the state put an end to that. But they're still negotiating that compact, I believe. Lori, you seem to be nodding, so you're from over that way, and you may know more about that than I do.
I believe they are still negotiating that. Mm-hmm.
Yeah. Any other questions on the casino revenue? What else?
That's all I have. Thank you.
Okay.
I have a question.
You may ask it.
Thank you. Do you know whether there has been an increase in the claims that people are making about their foreclosed properties? My understanding is that after the Supreme Court decision and subject to the revisions that the state legislature is looking at on how we use foreclosure proceedings.
So we have received an increased number of FOIL requests. So I think that's leading to that. I don't have the specific numbers of how many FOIL requests, but they have definitely gone up.
Okay, thank you.
Mm-hmm.
Okay, let's go to Ruby Pulliam, our Human Resources Commissioner.
Good morning, everyone. I just have a few things, 4 in fact, items that I wanted to share with the committee on today, starting with our Human Resources monthly data that we've been providing for you. As of the end of February, first part of March, we have a total of 864 employees on payroll.
Wow.
Now, that includes Board of Election workers. That also includes youth workers. So that number is higher than what we would say our normal average workforce is.
864?
864. And will increase because we're still onboarding election workers and we're just beginning the youth programs. As a matter of recruitment efforts, at this point, the county attorney position is in the recruitment stage, the budget director, 2 workforce deputy director positions, director of operations at DSS, and 85 other positions are posted in the process of recruitment at some way, either interviews, posted, or receiving applications.
Did you say 85?
85
Wow.
other positions. That includes the county and the municipalities that we oversee civil service administration for.
Oh.
Okay. In a matter of outreach, our Blue for You clinics are ongoing and scheduled to end
They end March 31st.
March 31st. We've had several hiring events and mock interviews with BOCES and 2 of our nonprofits. And in fact, today Larry is in Cortland for another job fair. So we are getting staff out, trying to increase our recruitment efforts there. Applications reviewed for that month alone, 471. Reviewed means going over what the applications are, making sure the correct documentation is there, and making sure they're under the correct titles. So it's time-consuming. Civil service tests posted to date for that month were 16 exam announcements. Civil service exam applications were 114. Civil service tests given, 15. Civil service test attendance, and I keep putting this in here because we have a very high no-show rate. So out of the 114 applications received, only 47 people actually came and appeared for the test. We have onboarded 13 employees, just the county. We've off-boarded 12. Out of those who were onboarded, 9 signed up for health insurance, the county's health insurance, 7 for the dental, vision 3, and the flexible spending account 9. Retirement onboarding, out of those 13, 8 onboarded for retirement benefits. Benefit leaves processed in the month of February, 32 disability leaves, 16 cancer screening, 13 bereavements, 1 jury, and 26 COVID leaves were processed. And that's basically our monthly totals for human resources in the categories that we identified. Any questions with that? Lee?
I'm sorry, go ahead, Lee, you first.
Are the disability leaves high? I mean, that'd be 5% a year. full-time workforce, roughly.
And sometimes it's in the same department. We have numerous leaves in the same department. So departments are really suffering when you have 2 or 3 people out on disability leave. But it's a great benefit. But we're just keeping track of the number of leaves we process each month.
Is that a kind of a steady number in that range, 30 a month, 32?
It fluctuates.
It does. And of course, depending on the department, that creates your backfill and overtime costs as well that the departments are having to absorb for 2 months, I think, before they can hit contingency.
It is a stress, but necessary sometimes.
I just wanted to mention that from time to time, we get a report on the new hires. And I can't remember whether it comes from your department or whether it comes from administration, but it's greatly appreciated seeing the names and the departments of the folks that we onboarded. And that made me think about it when you talked about that.
County admin has graciously taken on that responsibility of making sure there's a welcome for the new hires.
That's great.
Okay. The second thing is, I mentioned before, the HELP program sponsored by the New York State Civil Service. And for those of you who were at NYSAC, were able to hear the announcement that that program has been expanded, continuing for this year, and expanded to include the counties. And it's a great effort, and so that we can be able to and basically eliminate one of the barriers to a lot of our recruitment issues by offering permanent status to employees without going through the exam process. There's a lot that goes into it. There are certain conditions that we have to operate under, but I just wanted to let you know that we have already begun to submit titles for provisional employees who've been serving for 2 years without an exam, and we are getting those things ready to submit to the state. Heather, do you have the number of county titles that's on our first go around?
I do have the number. I don't have the specific titles, but there are 9 county titles going through in the first petition.
And those, we're going with low-hanging fruits. Those are positions that we've had people in provisional status for 2+ years without an exam. Either the exam has not been created or the exam has not been announced. So those people will be able to receive permanent status without an exam at some point.
That was Heather Buck on Zoom.
Yes, I'm sorry. The third thing, since Heather's been introduced, is our annual report that's to the State Civil Service that's due March 1st by law every year. And Heather has an overview of our annual report.
Good morning, everyone. Our office is required to submit an annual report to the state each year, as well as an exam fee report, which is just a snapshot of what happens in all of the civil service transactions within a year. So our office provides civil service oversight to 29 county departments and 26 municipal partners. We track employee information and changes for roughly 1,983 civil servants. Our office completed payroll certifications, which is a yearly audit of all employees, their titles and salaries for each county department and municipal partner. Our office conducted 119 examinations in 2023 for just under 1,000 candidates. We requested New York State review 13 titles for removal from the competitive class, 4 of which were under the HELP program. 12 of the 13 titles were approved. We currently have 148 provisional employees, which is 7% of our current employees, and that is county employees and our municipal partners. In addition to civil service administration, our office is also responsible for the following: creation and administration of salary schedules, collective bargaining, contract administration, employee benefits and employee insurance administration, maintenance of attendance records and personnel files, orientation and onboarding, employee grievance and discipline, training, recruitment, reward and recognition. And just to give you a breakdown of the 1,983 civil servants, 730 of those are county employees, and we track all employee transactions for our municipal partners for 1,250 employees. Are there any questions?
Rich John.
Just to make sure I understand it, when you say provisional employee, this is somebody who's been hired into a position but has not yet passed the civil service process?
Correct.
Okay.
Other questions? Shauna?
Do we receive any compensation for doing the tracking from the municipalities, or is that a courtesy that we provide?
We do not receive any money back for
Okay.
municipal partners.
Thank you.
I think probably that's because some of the municipalities are so small, they simply don't have the staff to do it, and that's why this is assigned by the state to us.
So this is an unfunded mandate.
Well, I think it's something nice that we can do, but
But yes, you're right.
Well, it's actually, it's our jurisdiction. Cities and counties, there are some counties who are responsible for the municipalities within that county, and then there are some where the cities actually have their own civil service. So at some point in time, the jurisdiction was established for Tompkins County. And if we ever change that, there's, of course, a process to go through for that. The only, I think, legal organization that will sometimes reimburse the county or whoever administers their civil service is the Board of Education.
Lee, then Rich.
In the annual reporting, are there diversity measures incorporated into that look at what's comprising the workforce?
I don't think so, Heather. We don't do a breakdown of demographics in the annual report for civil service. We do provide an EEO4 report every 2 years. That's required. That has that.
Just the county or
Just
all
the
of
county.
civil service?
Just the county.
Be interesting to know what others are doing as well in addition to the county's efforts.
We may be able to pull some reports. We may be able to. Heather, let's check into that. I'm not a big fan of our, I won't name the system, but we may be able to pull some reports that can kind of give you that information. We'll look into it.
Wondering what progress we're making on that front. Thanks.
Rich.
To Shauna's comment about are assuming this cost, I agree it is nice, but I think it's more than that. You know, we certainly want to be collegial, but just listening to the complexity of what's here, if we left it to the towns and villages to try to navigate through this, I think we'd have municipal chaos. And as the county in some ways is the municipal leader, this is an appropriate role. So I'm fine with that. Yeah.
And in some places, the exam fees have a cost to it. But Tompkins County has, for as far as I know, hasn't had exam fees in forever. Whereas a lot of the municipalities now who have their own commissions are now coming over and saying no exam fees to try to increase recruitment.
That somebody applying for the job has to pay a fee?
Applying for the exam. Because the county does have to pay the states for all state-rated exams. So in addition to this annual report of the actual numbers, we have to submit an exam fee report as well. So for every exam that the state rates, the state gets a percentage, a cost. There's a cost attached. And that report, Heather, you wouldn't have that number with you, right? We can provide that.
I don't have the number, but I do know it was just under 6,000 for
Right.
2023.
That's just a little extra ray of sunshine, isn't it? Okay.
Do the no-shows affect that?
No. When we ordered,
It's just based on the exam?
when we give the count to the state, and that's based upon the people who apply, regardless of whether they show or not, we are responsible for paying that price for that exam.
So those no-shows are costing us money. Not a great deal, but still.
If they're the only one taking the exam, right? I mean, if some others are.
Do we pay by the
We
number of
pay by
people?
exam, by the exam ordered. If we have
Individual
36
exams.
individual exams, if we have 36 people applying for this job, applying for the exam, then we order 36 exams, and we are charged for each exam.
Any idea what the average charge is per
I do.
exam?
It is $7.50.
So it's not a
for
huge
most
amount.
booklets, and it's $15 for uniformed positions.
Why does New York State do this? I mean, it's.
Well, you know, when we, I can remember years ago when we talked about not having these fees for the applicants, it was a real conscious effort to increase the number of people that were coming in, as you say, Ruby, to take that, and it was part of our DEI initiatives going back before we called them DEI, and we want more people to apply.
But the question of why New York State does this, you know, in Les Miserables, there's that.
It wants the
that
money.
There's that master of the house song about you take a little here, you take a little there, and how it adds up at the end of the day.
Yes, but just petty.
Well, it is the state of affairs. The last thing, if there are no more questions regarding the annual report, the last thing is Sarah Thomas, our employee benefits administrator, is here to provide an overview of our voluntary or supplemental benefits that we're starting to offer.
Good morning, Sarah. Thank you for coming in this morning. I think we have paper on our desks, too.
Yes. So I'm just going to give a really brief, high-level overview of the benefits that will be available to all employees, including members of the legislature, starting July 1st. And so I first also want to just thank the legislature for your support in this, because we couldn't have done it without you. And this has been like a goal of mine since I started with the county over 6 years ago. And it's also something that's a standard amongst most employers that we just haven't had. We have excellent health insurance, but these are things that most places have that we haven't. So I think from a recruitment standpoint, it's also going to be helpful to us. So thank you for your support on this. So I'm just going to go over the benefits that we are offering, our implementation timeline, and then just a little bit about how those benefits work. So we will be offering a whole life insurance plan through Mass Mutual, and then through the Hartford term life and AD&D, long-term disability, accident insurance, hospital indemnity insurance, and critical illness or specified disease insurance, as it's called in New York. For our timeline, over the next couple weeks in March, I'll be meeting with department heads, deputy department heads, and key administrative staff from each department to give a deeper dive into how these benefits work, what they're going to cost, what will be available to employees. Dan and Shauna and Katrina have graciously agreed to come and learn more about this for folks. And then by March 31st, mailings of materials will start to go out to employees. The month of April, we'll be scheduling several employee education sessions. We'll be going to a lot of in-person events, as well as having Zoom info sessions. We'll do email promotion. There'll be flyers going out. There will be mailings to employees. So we're going to make sure that all employees know about these new benefits that are going to be available to them for the first time. May will be our open enrollment period for these supplemental benefits, with the benefits fair for folks to come in and meet with the vendors, get freebies and whatnot on May 8th. The month of June will be processing enrollments with the vendors, and then July 1st is when coverage begins for all employees who opt to join these plans. The first payroll deduction is on July 11th. So just a little bit, any questions about that before I go on to sort of explaining a little bit about what these benefits are?
The last one, the accident, hospital indemnity, critical, is that a package, or do you?
No, those are three different kinds of, we call it supplemental insurance, and I will get to kind of how those work. So just briefly, for a whole life insurance plan, this is the one I'm most particularly excited about. It's something like a pension, which honestly I never thought I would see in my life, and it's an amazing benefit. And basically how that works is it's available for employees, spouses, domestic partners, and children. Whole life insurance is something that's really an investment while you're alive or while whoever you have the policy for is living, because you have your principal amount that you have elected, and then that earns interest over time, so it increases in value. Your rates are fixed at the age when you enter coverage, and it's something that you can take out funds to use for life expenses. So, you know, say you want to renovate your house, add an addition or something like that, you can cash out like half your policy, keep the other half, and actually use those funds while you're living. The next coverage for term life insurance and AD&D, it's cheaper. So it's more accessible to a lot of folks, and it's great to have something to kind of have in your pocket, but it only pays out in the event of the person who's on the insurance passing, so that benefit would really go to a beneficiary. For both of these plans, though, I'm happy to say there's no pre-existing condition exclusion, there's no medical questions or anything to get coverage. It's just guaranteed issue up to certain maximum amounts. Whole life, $150,000, term life, $200,000. So that's basically if people sign up when they're firstly eligible. No questions asked, they get the coverage, which is great. And even if they're dealing with significant health issues, the coverage will not be denied by the insurance carriers, which is great.
So when does the application period for these benefits begin?
So it begins May 1st. However, for the whole life insurance policy, we do have the opportunity to offer to folks to enroll early if they would like to do so. So that would be basically, honestly, any time starting by the end of this month that folks could sign up if they wanted to. Payment would not begin until July. So coverage would be essentially free until we officially become effective July 1st, but that is available for folks to sign up early if they know they want to do so.
Thank you.
Yeah. So onto long-term disability plan. Basically, what that is it provides income replacement if people are out of work for a fairly long time. Coverage starts at 180 days, but we have county disability plans, which Ruby was mentioned, and in general, they go about 6 months, after which employees would be in an unpaid status. So if they want to elect long-term disability, that would pick up where our insurance, where our disability plan leaves off, and provide coverage even after termination if the employee couldn't come back and they continued paying their premiums, of course, up to retirement age if they remain disabled. So the accident and hospital indemnity and critical illness or specified disease insurance, those are called supplemental benefits because, you know, your health insurance covers your medical expenses, but how these work is that they provide lump sum cash payments so that you can cover your other expenses if you're out for a medical reason. So whether that's, you know, childcare expenses or food, or it covers, you can use for co-pays if you have them. Really any life expense that you want to cover, these would cover. So it's not something that coordinates with our health insurance plan or impacts our health insurance plan. It's really just if you have elected the coverage and any of these things come up, this gives you additional income to cover life expenses. So these are similar, but they're for different things. The accident insurance is if there is an injury. It's not like just if it's a car accident or anything. It's any kind of injury. There would be amounts paid out. Hospital indemnity is if something should happen and you or spouse, domestic partner, and children are also eligible, were hospitalized for whatever reason, there would be payment amounts. And then critical illness or specified disease would be specifically coverage if an individual is diagnosed and treated for either cancer, heart attack, or stroke. And these benefits can be combined. So if someone, is injured and ends up hospitalized, they can claim benefits both for the injury insurance and the hospital insurance. So they stack on top of each other if folks are enrolled in more than one. And again, for these benefits as well, there's no pre-existing condition exclusion, which means they will cover whatever. And it doesn't matter whether you've had something happen before or are ill when you elect coverage, which is great. So.
What about portability?
All of these can be taken with you if you leave the county, which is great. It's just, paying as an individual plan. So, yeah.
Really glad to see the long-term disability. That's sort of like you hear Aflac advertises on TV, that kind of thing. And that's important to fill that gap that folks could have if they choose to.
We do see that happen fairly frequently, where folks are dealing with a more serious illness and then they ultimately end up going into unpaid status. And that's really tricky. So with something like this, they can have some added protection so they're getting some income while they're dealing with that.
Another one that someday maybe we could look at would be long-term care for like a nursing home, so that that's offered. For one thing, when you have those premiums, 25% of those premiums are a credit on your New York State income tax for long-term care. So
They're immensely expensive. And
it's very expensive.
And they don't necessarily cover all that much, but yeah.
Well, depends on
that one's a
depends on what you buy.
rip-off, yeah.
Shauna.
Can you tell me if the long-term disability premium, is that based on your salary?
I am not entirely certain. I can look at that and get back to you.
Yeah, that would be great. I'm just wondering for those county employees that, there's such a variance of pay within the county, and if it's based on the income replacement, it'd be nice if it was based on the salary that someone makes. Thank you.
Deborah?
I just wondered if we had any idea of how expensive some of these things are, because they sound very generous.
We do have rates for all of these, and I'm happy to email them out if you want to take a look at them.
I would very much, thank you.
And then we will also be bombarding people in a good way with a lot of information over the coming weeks. So, but yeah, I can send those out to you today.
These are very valuable benefits, thank you.
Lee.
Just a couple of questions and then a comment back to Mike. Long-term disability, do we have, you said there are employees periodically or frequently that are on that. How many would you say the course of a year do we have?
For
over 6 months.
The county's disability, we would have to get that from our leaves administrator. But right now, white collar, management and confidential employees are the only ones with that caveat for the county's paid disability. Blue collar is on the state's disability.
Okay.
So we could get that number for you.
And these are options that the employees would contribute to have that additional coverage.
Correct. Totally employee paid.
No match.
No match.
Kind of like the dental and some of the others that we've added on.
No match for these. These are strictly voluntary supplemental benefits. Now, I could give you a preview, because while we were doing this research, we did research the possibility of county supplementing a life insurance policy for all employees for, $50,000 each? And it basically runs up to about $6,000 a month.
For everyone?
For everyone. So that's just a preview of what's
6,000 each? No, just for the
total for our, what did we do, 750 employees for a $50,000 life insurance policy?
That's pretty good.
That's totally awesome.
So are you going to do that?
Well, I'm just giving you a preview. Right now, we're.
See it in the budget.
Yeah.
That would be a legislative
That's a
decision.
legislative decision. I just wanted to give you, we did check into those data, and I think it would be a great recruitment and retention effort on our part for very little. I'm just going to, from Niagara Falls coming here, we had an insurance policy, all employees, now it ends when you leave employment, of course, but it was 1.5 times your salary for all employees upon hire.
And state retirement provides a death benefit through active service, which is fairly substantial after a certain period of time. But yeah, that would be quite an addition. Just to Mike's point on the long-term care insurance, that really does have a benefit to the county directly from a dollar standpoint, and I would encourage anybody to be looking at it, because ultimately those that don't have long-term care that end up in skilled nursing, they're going to end up on our Medicaid programs, and that's probably what's the hit. Did we have something like 500 people in the county that we're supporting in the nursing homes at $100,000 a year? I mean, that is a substantial part of social services costs. So long-term care insurance does have a benefit a very direct benefit to our bottom line.
Good point. What else, Ruby?
That's it. Thank you all for your attention. I would also like to thank central admin, payroll staff, Thomas Nunn, all of those who helped us in reviewing these packages and then coming up with this proposal.
Thanks for that. Ruby, been having inquiries from our legislature chair about how we're doing on our direct report efforts for the review of those, and you and I have talked, and I noticed we just got the compilation of the duties that was put together. I hope everyone got a copy of those.
That was just sent to the SMART group, working group.
Oh,
the compilation
okay,
was.
Okay,
and we have a meeting this afternoon.
So that group is moving.
Right.
At some point, we're going to have to assign legislators to an interview teams for these direct reports. And at what point do you think we should be thinking about trying to corral some of our legislators?
Now.
We should start thinking about that now. Okay, so are we going to be the group? I'm throwing this out rhetorically to our members of the BCP committee, or are we going to bring in others? What do we want to think about doing for that? So if we need to start talking about it now, let's ask about it. We see hands. Deborah.
Did you see a hand, Mike?
Thank you.
Yeah, it's the military volunteer process.
When we did it, let me just say, when we did it before, the budget committee was the interview committee. And I don't know whether you still want to do that, but we always invited everybody else who wanted to come on the legislature to them. And sometimes we did get a couple. Remember Dooley coming to them usually.
When you talk about an interview process, in years past, we filled out a form. We rated people on various, I think, not very helpful categories. And if that's the process that we're going to follow, obviously everybody does that. And I'm sure that the criteria will be more specific and more geared to giving us valuable feedback. But when you talk about an interview, what exactly?
We actually got together and reviewed those when they came back. And we actually invited the direct reports in and they had them also so they could see what it was. We talked about them. And I think we had like 2 meetings with each and actually set goals at that point.
Well, don't you think a good place to start with putting together a committee is to ask our legislative colleagues who's interested in participating in that. I mean, I think anybody who's genuinely interested in that, in participating, should be allowed to.
Yeah, and we did do that
Yeah.
before. And as I said, we probably had the basic committee, and then we probably had at least 2 or 3 others that came to the meetings. Shauna?
Yeah, I think that's a good idea, because at any given time, I feel like our schedules kind of go up and down, and sometimes we have more availability than other times. And if there are a legislator or two that want to head up, you know, if we're doing one position, maybe a legislator head up that review, and then another legislator head up another review. And then perhaps whenever it's time to deliver the reviews, anyone that wants to can be part of that delivery.
Let me put out an email explaining that and asking for people who might be interested. And I don't want to exclude them if they become interested a little later, but I'll write an email about that. Does that make sense?
Great.
And I'll send it to the legislature.
Mike, if I may,
Yes.
we need to make sure that we're describing this as a performance program versus a one-time activity. One of the reasons for asking for specific legislators to serve as contacts throughout the year is so that you may identify and sometimes resolve issues before you actually come up to that annual performance evaluation. So this group of people, whether it's 2, 3, 4, however many, will be kind of serving as the contacts for that direct report throughout the year. So you will have the initial dialogue, which basically sets forth their expectations. What do you expect this person to achieve? You will have something like a mid-year evaluation. And then as the year goes on, you will discuss issues, resolve issues, change the plan, whatever needs be, and then with your annual actual evaluation. So if you're looking for a one-time event kind of thing, that will not match what we're trying to develop here. So we're looking for actually people who were served as, say, a director of finance. I don't want to call it mentor, but that person will go to you all when there's an issue rather than waiting to go to the 14. Similar to what we did in
like a contact group.
Right. So that person, everyone will have an opportunity to evaluate the direct report using the survey questions. But there needs to be some group that will have direct contact with so that the direct report can come and say, look, we're having issues with this. And if that needs to be reported out to the 14, then they will do that, just as a way of keeping the communications channels open so that there are no surprises at the end of the year when you are doing that evaluation.
I'll be happy to adopt Lori.
I do adoptions.
So it's just a difference in the way we've done it before. An annual performance program is different from just an annual evaluation.
I hear what you're saying. I'm just trying to think if we can't just, it seems to me that we aren't going to have 4 groups of people who want to adopt a particular direct report. So can't we have one group that does all of that?
Why do you say that?
Well, I just don't think you're going to, I may be wrong, but I just kind of think, are we going to have 16 people from our 14-member legislature? People doing double duty? How are we going to, I'm just not sure how it's going to work.
It doesn't have to be 4 people. It can be, Deborah.
Well, I was going to say, if you're just looking for a core group that serves as an intermediary or a sounding board, somebody who hears about the problems first, I mean, that's pretty much what we do in this committee, isn't it?
Well, that's what I kind of wondered. But we do have this working group already that's been working on putting together the issues for the for what we expect from the direct reports.
But that was task-specific.
Right.
You know, I don't think they volunteered for, you know, ongoing adoptions.
All right.
We can volunteer our colleagues that aren't here.
I think there's some benefit to spreading this out wider, because where I think we've struggled a bit is, I don't want to use the word trust, but that the 14 of us feel a responsibility that this is our job, and delegating it to individuals doesn't feel right. So we end up with 14 people trying to do some sort of management supervision, and we do it terribly. But if, just doing the math, if we had groups of 3, you know, and the 4 people are each given a group of 3, you'd have all of the legislators with some management responsibility on an equal plane, other than 2 people. Maybe that's the chair, vice chair, I don't know. But you couldn't say one group is, you know, doing things that the rest of the group didn't know about or whatever, because everybody's going to be on it like they're on committees. But until we get it down to that level, I don't think we're going to really do a very good job of oversight.
I think then what I need to do is kind of outline this at the next legislature meeting, and saying that's what we're going to look for, and then follow up with an email and ask people who would be interested in volunteering to do that. Does that make sense?
Well, if it was 3 on a group and everybody had to be on a group, there wouldn't be, you couldn't really unvolunteer, which I kind of like.
Ooh.
I mean, that everybody's got to be on one of the groups, that everybody recognizes their responsibility.
But the reason, if I may, the reason
Okay.
that I suggested soliciting expressions of interest is that I think that our groups would be more effective and more helpful to our direct reports if they were limited to people who were actually interested in doing it, and not people who got assigned to it because we had to have 4 groups of 3.
Maybe that's right. I don't know. But
And if that means that some people have to be on more than one group, so be it. I mean, I don't know. I can't speak for our direct reports, but it would seem to me that you all don't want to be trotting off to talk to somebody who's only listening to you because somebody told them they had to.
yeah, I guess I wouldn't see this as, maybe it turns out that way, but I would think it would be far more positive that the groups of 3 would develop positive relations with whoever they're.
It's a goal. It's an aspiration.
I don't know.
I think the process, if we were going to do it your way, Rich, we would have to have the chair appoint them to the various subgroups. But all right, let's take it one step at a time. Let me outline, and then I'm sorry. Somebody.
Veronica has her hand up.
Oh, hi, Veronica.
Hello. Just my thought listening to this is I like Rich's idea, and since the supervision should be everyone's responsibility, but I wonder if you could solicit volunteers, like if each little group could have one like head of the group, and that could be from volunteers who are interested. So for instance, maybe Deborah volunteers to be like the main person in Lori's group, and then a couple other people get tacked on as well. And then Lori then everyone, you know, every legislator is part of the supervision of a direct report, but also every direct report has at least one legislator who is like signed up, committed, invested in building that relationship and being that point of contact.
Good compromise, Veronica.
Okay, we'll try to outline something for the legislature then and see where we go from there. And I'll talk with Dan also about it. Anything else, Ruby?
That's it from Human Resources.
Well, thank you, and Heather and Sarah too. As far as my report, I would just say that I have had nice conversations with both Ruby for her department and also Lori for her department, and they both have a lot of work a lot of work out there, and we need to be as supportive as we can. We expect there'll be issues coming up budget time, and Lisa's going to be bombarded from all departments. We know that, particularly with staffing issues that are going to be under question. But interesting to know we have 864 employees, even though that includes the BOE people and the youth people, but that's a lot of folks on payroll. That's really all I wanted to report. Can we go to Veronica? Veronica, I liked your background. I wondered if you were up at Cornell swimming at Flat Rock on these nice days.
I wish. I don't know if the internet connection would be that good. No, I'm in my house, and you don't get to see the chaos. So from Workforce Diversity and Inclusion Committee, I guess I have, well, one comment first, 2 updates from our last meeting, and 1 reminder. The comment, I haven't been here for the whole meeting, but I'm happy to hear about the various benefits and disability leave and such that we give to our employees. And, you know, I don't know the ins and outs of it, but I think overall it's part of allowing our employees to be human with disabilities and all. And as long as we're employing a human workforce and not a robot workforce, we've got to care for each other. The 2 updates from the committee meeting we had on February 22nd. We talked about committee goals mainly, and 2 things that we turned a lot of attention to. One was about personnel in our workforce and diversity metrics, which Lee kind of brought up in one context already. The committee wants to follow up more on keeping track of how the diversity and inclusion in our workforce is going. And Ruby and other HR folks, this is going to be like more in-depth offline conversation. And I'm sorry to not have checked it with any of you before now, though a couple of questions that came up that might be easy to answer right now. One is when, I guess not forever, but like when I was onboarded, and maybe for the past few years, we filled out a demographic sheet. Like there was formal sheets to be reported to, I don't know what all, but there was also just a voluntary sheet if you want to fill out more demographic information. Where does that information go?
Ruby, go ahead.
That information, if it's completed, is put into our UKG system. So into our payroll system. But again, it's optional and it's how people self-identify. And we only ask the questions that are required in our federal reports. So that's basically race, gender. Age is not on there, but race and gender is what we usually have to report.
For the voluntary stuff, do you are there any reporting metrics or statistics around that? I know it would all be with the caveat of this was voluntary, not everyone filled it out, presumably.
Right, that information goes into our EEO4 reports. That's the only reporting that we really have to do for that type of information as now.
Okay, thank you. And I don't know how to go about this, but there was some interest in our committee meeting from at least one employee who'd been here a long time and doesn't remember filling out that sheet. I don't know when it started, and wondering if folks who never got a chance but are part of our workforce could have the option to fill it out.
Sure, they can call the office and ask for that form. We only collect that information as they're onboarded, but if they would like to make sure that that information is in their personnel records as far as UKG is concerned, then we can do so. We can give them the form.
I just want so Thomas is working on a self-serve part of this, and that might be something that we could also talk to him about, providing that as a self-service to the employee to be able to enter that information.
That's perfect. That's something we haven't gotten into yet, but we're working on that self-serve portion to our payroll system where employees will be able to go in and do updates or revisions as necessary.
Okay, that's awesome, thank you.
Okay.
And that question had come from someone who's been here for decades, I think, and.
If you could just let that person know, they can just contact the office and we will make sure a form is given to them and make sure it's put in the right place.
Maybe, Veronica, you might want to mention that at your report to the legislature.
Yes, good idea.
Questions for Veronica?
Oh, sorry, I have one other.
Go ahead.
I guess the other question on personnel, maybe for Ruby, is what happens with information that comes from exit interviews? Where does that live or go?
We have an exit interview folder. We have just begun, if there was information that we think the department would need to know as far as policies and procedures, we've just begun meeting with departments if there was information that we thought should be shared. And of course, that's with the permission of the person participating in the exit interview. As far as I know, that information is simply in one of our files designated exit interviews. And again, not everyone completes an exit interview. And usually when they do, there's really a point to be made. So that information is not really disseminated because it's sometimes without context.
I can imagine. Thank you. The other update from our meeting was we talked about the committee being part of an infrastructure of accountability for departments around DEI work. And looking back at the county's diversity and inclusion policy, one of the pieces in there, and I guess I'd be interested to hear from Lisa on this, since I know Lisa's on WDIC, but was doing a NISAC training during our last meeting. One of the pieces of the policy is that departments should, what does it say? The county administrator, in consultation with WDIC, shall assess annually each department's approach to incorporating the county's diversity and inclusion expectations as outlined above. And the county administrator, in consultation with WDIC, shall on an annual basis recognize departments that achieve their annual diversity goals. And we were hoping that WDIC could be a place where departments could do some sort of presentation of what their DEI goals are, and then maybe at the end of the year, the beginning of the next year, have they achieved them? How did it go? And I don't know exactly what that would look like. Of course, that's not just the committees to decide, but that was a thing that came up and that we thought would be important. I know multiple people, just from their own experiences in other places, being on the side of like the person who had to present goals or results, said that having to get up and talk in front of a group, even if it was just like for 5 minutes, was very helpful and motivating to like get things concrete and understand what we were doing. So that is a thing we're interested in. And I don't know if you have thoughts on it. I guess I'll also add, this is the last thing, just a reminder, though I'm sure you've talked about it, of the DEI Leadership Summit happening that Charlene Holmes is co-organizing on April 9th, the day after the eclipse. This is a Tuesday from noon to 5 at Ithaca College. And this is for leaders, the definition being a leader in this context is defined as an individual with direct reports or someone who holds organizational decision-making and influence. So if you haven't signed up for that yet, please do. And
Thank you. Thank you, Veronica. Nice report. Questions and comments for Veronica? Lee.
Just a couple, one comment and one question. After 25 years as a department head, I can think of several potential exit interviews where we'd have to heavily redact the transcripts. But to the point, and Veronica came back to, it's considering the voluntary information in the hiring and so on, it just seems to me it's going to be problematic to measure how well our diversity recruitment and retention is going. I mean, are we able to actually see some numbers to know from the investments that we've made into diversifying the workforce that we're actually seeing success there?
It depends on how you're going to measure success. We can measure demographics information that we collect as far as how many women, as far as gender and race is concerned. But diversity is so much more than that. Mm-hmm. So if we have certain goals, we have to make sure those goals are specific, they're measurable, and they're achievable. And yeah, I think.
Deborah?
Yeah, I think if we just focus on demographic diversity, given that we're kind of at the mercy of a job market that's heavily weighted in favor of the employee rather than the employer, given people aren't really excited about applying for civil service jobs, given that we still have to deal with the hurdles of the examinations, given that department heads don't always have a lot of control over recruitment. I think that we have to view DEI much more broadly than just demographic diversity. Because I have questions about giving a department a goal to meet a demographic factor that they really don't have any control or ability necessarily to meet. I think it's more important for us to set goals that rate people on how they treat their employees and how opportunities are provided for people, not only based on their demographics, but do they have a disability? Are they facing some sort of family problem? I just think that that's really what equity and inclusion is about. It's not, the diversity piece is just one part of it, and to me, it's a smaller part than the other parts. I don't know if that helps.
It does. I just come back to the Ed Cash question. How am I doing? And we've this has been an offshoot in some ways from the cultural surveys that we've done with the work staff, as well as other initiatives to bring it forward. And it's really had a lot of focus, and I'm just curious, how do we know how well we're doing?
And that's what I was going to point to as well, is that the climate survey may be a better indicator or a more complete indicator than just looking at demographics.
Would also add to that, I agree. Part of the work that Charlene, our Chief Equity Diversity Officer, is helping us do is look at DEI in terms of systems and frameworks, so that our efforts are systematized and not a one and done, and that we know why we're doing what we're doing and what our goals are, so that we're in the past we've done a lot of measurement and we've produced a lot of demographic reports, but I don't know if we ever truly and we knew that our numbers weren't where we wanted them to be, but I don't know if we ever clearly had a stated goal of what we wanted to achieve and when we had arrived. Not that there's ever an arrival point, but so that's one thing I wanted to mention, that I think we're really trying to look at what our what are the best frameworks and measures to put in place to get us where we want to go. Secondly, in terms of the, Veronica had mentioned the departmental goals for diversity, equity, inclusion initiatives, and what's in our policy. And the systematizing that, I think, is also very important, because with 28 departments, I think WDIC could spend the entire year asking departments to come and just report on this. If you wanted to report at the beginning and the end of the year, I mean, that would just be what the meetings would consist of and nothing more. We have embedded it in our performance dialogues with all department heads, diversity goals and initiatives, and from year to year. And there's, so that's a part of those conversations and a part of goal setting and accountability at the end of the year. So that's one way that it's embedded and systematized and routinized, so it's not just a one and done type of event.
Well, I can remember the heartburn I had as a department head and, 30-some employees, and I would see a Excel sheet come out that showed basically how homogeneous my department was. And to the point of recruitment and the test taking, we invested significantly in recruitment into many diverse communities, and would sign up. I remember one test for dispatchers that we had, I think 150 people signed up for, and then the number that showed was way low, much lower than that, and we weren't seeing the success. And that's always brought me back to this question, what really is diversity, and how do we get there, and how do we measure it? And I'm not sure every year we could come in and talk through the process and say, well, this is what we're going to try this year, but I never could see where we were hitting some level of success unless we were establishing diversity as something that was unattainable, diversity and inclusion. So, and I don't think, in what I'm hearing today, I'm not sure we've gotten much past that.
Veronica's hand's up.
Yeah, if I can jump in, multiple thoughts. One, I think the department goals don't necessarily have to be demographic at all. I guess I'm sort of bringing two separate things, especially, certainly say like in a 2-person department, that how could you even do that? But I think DEI goals are gonna look really different in different departments. I can't pretend to know what they would look like. And I don't, Lisa, you're totally right. We could just spend all WDIC meetings hearing from departments, which would really make agenda setting easier, but I don't think we should be doing that. I will say people talked about wanting to hear at the beginning and end of the year. I would also say the end of one year is the beginning of the next year, so once per year is probably sufficient. I think would be some value in having some of the reporting on DEI goals be public in some way, even if it's just like a little overview of it. But also I'm not out here trying to cause department heads heartburn. And I appreciate, Lee, I always appreciate your sharing of your past experiences and other roles at this organization. I think that's, I don't know, it's super, super helpful to me. And I've forgotten, what was the other thing I was going to say? Oh yeah, the demographics stuff. It sounds like it'd be helpful as an organization, and I'm sure Charlene could say more about this, to identify diversity and equity and inclusion goals, looking at where we want to be or where we want to be going just in general, regardless of what we can measure. But then looking at, okay, what we can measure and how, what changes we would want to see in metrics that we can collect, but not necessarily letting the metrics themselves drive what the goals are. And also understanding that all this is happening in a context of an inequitable world that is, people are, you know, growing up in and working in, for instance, to get to the point where they are applying for a civil service exam. And so we can try to shift things to be more inclusive, but we can't just fix everything from within inside Tompkins County. Also, this is, I won't take too much time, but this lovely book, oh no, you can't see. Let me unblur the background. Thinking in Systems by Danella Meadows, I happen to have right here, and it's like very on point for the systems thinking and not letting metrics drive your goals, and I recommend it.
Thank you for that. Okay, can we move on to our resolutions? Before that, I want to stop myself. If you got your books, reminder that our budget retreat is going to be scheduled for April 30th at 5:30 p.m. somewhere. We don't know yet where it's going to be.
Is that a Thursday, Mike?
April 30th, 5:30 p.m. It's the annual budget retreat.
Is that a Thursday?
No, it's a Tuesday. It's always Tuesday.
Okay. Let's go to Resolution B, authorization to appropriate funding, implementation of memorandum of agreement between Tompkins County and the Tompkins County Deputy Sheriff's Association, ID 12230. Can I get a motion? By Rich, seconded by Shauna. You want to talk about this, Lisa? Or who wants to talk about this?
I'd be happy to. This was discussed and excuse me, agreed upon with the bargaining unit as a measure to take to address some wage disparity with other localities, primarily IPD, in their new contract, to try to maintain, not match, but maintain some level of competitive salary to address some recruitment issues.
And I think this was reviewed with the legislature as a whole.
Yes.
Ready to vote? Those in favor? Those opposed? That's unanimous. Resolution C, additional positions, Department of Emergency Response, ID 12284. Someone want to move that one? Rich, Deborah? Any comments on this one? Rich?
It looked like it's 3 positions.
It's 3 FTEs, so it's, I'm surprised actually to see it's 3 positions. I thought it's 9 total, 3 part-time, 3 full-time, 3 per diem.
Per diem, right. And these are the ones, the per diems were the ones that were not filled, or were not, they didn't get it in the resolution at year end to request those positions.
So this just implements something that we had already put in the budget?
It's budgeted, yeah, for sure. It's not new money. It's just that those positions at the year-end resolution, they'd only put in enough to cover the regular part-time,
So we've
full-time.
established the other positions.
That's right.
This is just the rest of them.
This is to add them to our HR system. Yep.
So this will do what we need to do so that when we're ready to launch the rapid medical response, we have all the positions in place.
Correct. Yeah.
Thanks.
Yep. And you will be seeing a resolution soon to establish a separate account for this as well. We're establishing a functional unit for this as well.
My understanding is the interviews have been concluded and pretty much everybody has been hired that's going to go into the program. Is that correct?
So are we okay with the title additional positions, or do you want to change that? Or?
That's correct. This is
okay.
This is the net. It's not the program in its total.
All right. Ready to vote?
I just had one
Go ahead,
comment for
Rich.
Lee, yes, and I had a chance to talk to Michael Steitley, and he was very impressed with the pool of candidates we got. We had a lot of them, and they were very qualified, so I think we're off to a good start. I hope.
All those in favor? Any opposed? That's unanimous. The two we added to the agenda, we've got the resolution supporting proposal to modernize the state sales tax laws to include vacation rental industry and to ensure these changes are appropriately tailored for the needs of localities. Someone want to move that one? Deborah, is there a second? Seconded by Shauna. This is in support, as I understand what Greg Mezzi told me, of a resolution adopted by the New York State Association of Counties at the legislative conference. And it's to try to make sure that vacation rental properties pay their fair share of sales tax.
Who's going to monitor that, Mike? How do you even go after it? Somebody in assessment will be monitoring the Airbnb.
Yeah, it's the same as we do now, I guess.
Lori looks happy, so I guess it must be her.
Oh, it's her office.
I thought the platforms
Yeah.
had agreed that they would assist in doing this.
I think that's what happens with
VRBO and
Airbnb, isn't it?
Yeah. You don't need to look so sad.
Here's my crazy question for the day, given the hell I caught in the diner this morning. Will we
You should avoid that locale.
Especially the week the assessment notices come out, yeah. Does this open the door to reevaluating the properties that are being used and generating income for Airbnbs?
I don't know, but I doubt it.
No, March 1st is taxable status date, so anything after March 1st goes to the next year, as I understand it.
Yeah, no, but it changes the nature of the occupancy of the homes.
Well, I should think it would depend on whether the fact that you were using your property at some point for vacation rental turns it from a residential to a commercial property.
Yeah.
And that would be Jay's problem.
Mm-hmm. But it's something to keep an eye on.
I think that's a good question for GO.
Yeah.
To have Jay come in and talk about that element, because you're right, it does change the use.
Because Jay doesn't have enough to talk about.
Yeah, I know.
But I think we must all already be aware of a lot of the vacation rentals, if not all of them. I don't think that's going to be anything new for the assessment department.
Well, I don't know that the county is aware. I think that depending on which municipality you live in and what their local rule is about whether or not you have to register if you rent your property for over a certain number of days, they would know. I don't know that they report that to Jay, but I think Rich is right. That's a question for GO.
I believe they reported to the Treasury, to Lisa Schott and the Treasury.
Well, anyway, on this resolution in front of us, are we ready to vote? Those in favor? That's unanimous. The other one we added to the agenda was the out of whole health authorization to accept funds, execute contract and budget adjustment, opioid settlement funds for whole health. Someone want to move that one? Rich? Shauna? So it looks like we got some money coming in, revenue of $276,000 and $276,600 from the settlement. Where are we discussing how to use that money?
Isn't it in the resolution? Aren't we giving it to Catholic Charities?
I'm not sure how
For a
we-
housing,
Oh, we advertised, okay. Yes.
I don't know how we made that decision.
So I'm not looking at the resolution yet.
Does the Division of Purchasing duly advertise a request for proposals for the Innovative Housing Solutions and Intensive Support Program to be funded by the opioid settlement funds?
I can answer that a little bit. So there was an RFP put out that would house people and offer wraparound care management services. And I'm not sure we had very many applicants, but they decided that this program that was offered by Catholic Charities would be a good fit. I believe it's $300,000 for 2 or 3 years. Is that right? Lisa?
I believe so, yes.
Yeah. Some of the feedback that I had heard from our nonprofits was that this is a lot of work and the expectations are really high for such a small amount of money. So I think Catholic Charities is going to make the funding work and provide, essentially it would provide a supplement to some of the services they're already providing.
Okay, any other comments? Ready to vote? All in favor? That's unanimous. What else, folks? Next time, I'd like to start discussing about our processes for the EBC that we'll be having this fall. And maybe we can even talk about it. No, I think we can start talking about that, how we're going to be having the departments present, for example.
Okay.
Shall we adjourn? We're adjourned.
But thank you, Mike.
Thank you, Taylor.
Thank you, Mike.
You said.